Moving on towards our next keynote presentation by our strategic partner, AI Nexus Healthcare, is on telemedicine evolution and health ecosystem by Faramarz Farhoodi, Chief Executive Officer. Welcome, and the stage is all yours, Faramarz.
Hello, thank you, and hello everyone. It's 4:30, actually 4:15 in the morning, my time. So I just say hello, and we'll get started. And thank you for the opportunity to give a presentation. Okay, can you see my screen?
Yes, we can.
Okay, wonderful. Well, so I represent AI Nexus, and I come from the technology background. I've been in artificial intelligence for about 30 years and divided between defense and healthcare, two sides of the coin. And I'm really here to present our experiences and the work that we're doing. And our work is guided by a panel of medical specialists in the UK and the US. So I'm really going to be focusing on preventative care and trying to address some of the challenges in sustainability and access to healthcare. So basically, as I've been listening to all of the speakers, the current healthcare systems are not sustainable. There is a global shortage of medical professionals, and this is expected to get worse. Of course, clinicians across the world are overworked, overtired, and overwhelmed with information, data, and demands that well exceed supply. And of course, there are some early warnings of a mental health tsunami that is coming as well, and definitely not helped by COVID and exacerbated by it. So telehealth technologies enable remote engagement with patients, and they've been very helpful and useful, and of course necessary because of COVID, convenience, and of course allowing access to available capacity. But the problem is that telehealth does not really address the capacity issue itself. The inflow of patients is simply overwhelming and is overwhelming healthcare services across the world. And right now, about 50% of the world's population, according to WHO, does not have access to basic healthcare services. So healthcare needs to become smart care. And we believe that AI is the potential enabler of this. So our target right now is chronic diseases that 80% of which are preventable. And we're hoping to build technologies that can transform healthcare from sick care as it is right now, with a focus on acute care, to healthcare by enabling intervention and prevention of chronic diseases. So that's what I'll be talking about mostly today. So this is an interesting chart from Duke Center for Personalized Healthcare. So as we can see, the majority of healthcare services are targeting intervention at a pretty late stage in the disease cycle, especially with chronic diseases. There's a massive opportunity to improve basically detection and basically treatment at much earlier stages, which typically last over several months and years, whereas this area is typically neglected, and all the focus right now is on acute care. And this is where the pressure actually has been building up for many years. And of course, because of COVID, has become unsurmountable. So we believe that there's a big opportunity to introduce AI during the earliest stages of a disease, and enabling individuals to actually become self-aware and health-aware and actually better look after themselves. And of course, if there are indications of disease, for that individual to seek health earlier or sooner, rather than waiting until things get a lot more serious. So prevention and early detection of disease requires a new generation of AI-assisted apps, and I'll be going into that in a moment. So current healthcare apps, and millions of users, and by the last count, about 1 billion people in the world actually access some kind of healthcare-related app. they're really focusing on collecting and displaying data and presenting data that patients or individuals actually find difficult to understand. Many people have wearables. There are 700 million wearables, for example, sold every year. And very few people actually understand what these wearables are telling them. Inconsistency in data, and also, of course, difficulty of understanding what is actually been said. So we believe that the next generation of healthcare apps needs to be developed, which are much better at analysis and diagnosis and actually providing actionable, personalized advice to individuals. And I'll be giving some examples of that in a moment. So again, to emphasize that we believe that AI is the key to turning healthcare into self-care, because it will enable interpretation and combination of thousands of data points, and actually translating it into early warning of physical or mental ailment, explaining to the users, what they can do to improve their own conditions or their own well-being, and of course, giving them actionable advice, including how, when, and how to basically go about seeing a medical specialist. So sooner rather than later. So of course, the current healthcare apps that are out there fail these expectations. There are 350,000 healthcare apps out there and thousands of devices, but not many people actually understand, what these devices and apps are telling them. So as a result, 53% of current healthcare apps are uninstalled within a month. And the main reason given for it is that, that the data is not actually actionable. So people actually don't understand what the apps are telling them. So we've been talking about AI. So which AI is best? And to some of you, this may be a strange question, because most people think AI equals machine learning and neural networks are deep learning. Therefore, the question is a strange question to ask. Now, for people like myself who actually have been in the field for many years, we've seen waves of AI coming and going. And most of the technologies that we're using today, including neural networks, have been around since the 70s and 80s. Of course, they've been evolving and developing, but essentially the fundamentals are still decades old. So what we have actually understood and seen in healthcare is that there's too much focus on machine learning, in particular deep learning. So, and of course, the benefits of deep learning are great in terms of recognizing patterns in data and helping us see things that we would not normally be seeing in this massive, vast volumes of data. But the problem is pattern recognition is not cognition. Doctors don't sit in front of thousands of images of tumors or if you like, ECG data in order to understand or discern that there's a problem with the patient. So what we need to really do, we need to really do a better job of actually assisting medical specialists by capturing and representing how they go about doing diagnosis and patient care, and not try and just, if you like, rely on data and patterns in data as a substitute for the medical expertise. And of course, in many cases, machine learning requires massive data sets or specialized data sets that have been labeled that are not actually available. So in many cases, actually machine learning cannot even be applied. So telehealth requires AI, we believe, that can embody the art and science of medicine, and basically knowledge that's actually obtained from the source, which is medical doctors themselves. So now, this is a pretty scary picture, so I'm not going to go into it, but this is the field of artificial intelligence. As practitioners in the field for many years have been thinking about. From left to right, it involves a variety of tools and technologies, but in particular, in the middle, knowledge representation and reasoning are fundamental to the representation of intelligence or any kind of a reasoning which would be necessary for diagnostic processes and giving actually actionable personalized advice. Right now, the focus of the industry, pretty much 99% of what is out there and touted as AI, focuses on deep learning, which is an important but a very small subset of artificial intelligence. So the rest of it has been pretty much ignored. And this is where we believe the solution lies in terms of improving the adoption of artificial intelligence in healthcare. So we believe the solution is a what we call hybrid AI, which is combining cognition with recognition and basically building AI systems that can actually reason and think like doctors do. And that gives you the best of both worlds. You know, on the one hand, you have the benefits of deep learning or machine learning in recognizing patterns, but on the other hand, you actually have mechanisms that actually can interpret this data and actually come up with actionable advice, which actually would enable us to build applications that can help individuals, consumers, individuals, as well as carers who may not be medical people, to actually have a better understanding of what actions they can take to stay healthy and when to see a doctor sooner rather than later. So now I'm going to go quickly through some examples of telehealth and actually show how this kind of technology could actually be transformative in each of these areas. So first of all, starting with mobile health, where individuals actually download apps or medical organizations actually give out mobile apps for people to actually keep connected with them. So right now, a lot of consumer apps in particular focus on statistics and data. This is an example of sleep data, REM sleep, deep sleep, light sleep, and give you a whole bunch of numbers and fancy graphs on your sleep. And very few people actually understand how this actually relates to any indication of health. So compared to this on the right, where the application is actually intelligent enough to notice the person is actually suffering sleep disturbances, and the symptoms, according to the CDC, are consistent with sleep apnea, which could, of course, result in some serious healthcare issues down the line. And as it happens, this particular person also has hypertension, which has also been aggravated over time. Of course, there's a relationship also between sleep apnea and hypertension. And of course, there's a recommendation to actually seek medical assistance. And of course, there's a whole bunch of data that's behind this and a whole bunch of analytics that would improve patient-doctor interaction. So next, this is an example for remote monitoring. Now we have typical alerting devices that people can wear, including the Apple Watch, by the way, that if you fall, they can ask you, hey, did you fall? And then, do you need help? And should I get someone to come and help you? The problem is that's reactive. We could actually build proactive alert systems that actually can understand or observe the behavior and biosignals of seniors or people who are vulnerable remotely, and actually alert to the fact that if someone's fall risk has actually increased due to, for example, a heart block, or it could be due to sleep disturbances, or indeed gait abnormalities that could all be increasing the risk of someone's falling. So, and that would be an early indication of care instead of waiting for someone to fall and break their hip and then go to hospital with all the costs and expenses that would ensue as a result, putting aside human pain and suffering. And finally, telemedicine. So going from sight, where we just see someone on a video and then ask them a bunch of questions. And of course, there is very little connection often between the doctor and the patient, to insight, where a patient could be basically, again, present in a video, except the computer system, the AI, can actually collect from the patient's face a whole bunch of diagnostic information, cardiac data, arrhythmia data, as well as risk factors that have all been collected over time as a result of observing this particular patient. This is an example of a real system that we've been working on that can actually detect stroke and basically Bell's palsy, as well as key biosignals just from the face in a video session, as well as various types of arrhythmia. And it could be extremely beneficial to a physician to actually ask questions they wouldn't be asking otherwise. So we believe that hybrid AI is the key to accessible, affordable care for everyone, everywhere. And thank you for listening to my presentation.
Thank you so much for the presentation, Faramarz. It was definitely insightful, and I'm sure all our delegates who are attending definitely have received a lot of information from your keynote.